is Timothy Dublin. Today I will present to you my capstone and 5-year plan assignment, which will provide some specific details on my journey through the baccalaureate degree program at Lamar University. I received my associate's degree of nursing from the College of Staten Island in December of 2009. I'm currently on pace to receive my bachelor's degree from Lamar University in May of 2019. I currently work as an infection preventionist where I began in February of 2018. Prior to that, I was a staff nurse at the bedside from November of 2015 through February of 2018, and I began my career as a clinical unit manager in a long-term care facility in August of 2010, and I worked there until November of 2015. Currently within my facility, I am a member of the Infection Control Committee, the Emergency Management Committee, and the Patient Safety Committee. I'm certified in basic life support as well as advanced cardiac life support, and I am an active member in the Association of Professionals in Infection Control and Epidemiology, known as APIC. At Lamar, the RN to BSN program clearly outlines 7 student learning objectives which are to be met by the program's end. I will discuss the where and how I met these objectives. Student learning objective number 1 comes from the Humanity and Society construct, and it says practices safe and effective holistic patient-centered care to a variety of patients/clients in multiple settings from a global perspective by incorporating theories and evidence-based findings. I believe I met this objective in Nursing 4620, Care of Patients with Compromised Health States. The assignment was discussion number 2, Evidence-Based Guideline and Protocol. This discussion focused on elderly fall prevention. I discussed an evidence-based guideline which was developed by the University of Iowa College of Nursing, which was a 10-step protocol focusing on fall history, fall potential, and the development of a plan during the length of stay. I also met this objective in Nursing 4540, Care of Communities. The assignment was DVD number 1, Disaster Preparedness for Individuals and Families. This DVD educated me on different types of disasters, different phases of disasters, types of preparedness, some local and federal resources, levels of response, as well as rescue management. I believe I met this objective with 90%. Student learning objective number 2 and 3 both come from the Lifespan Health Continuum construct. Objective number 2 says supports patients and clients in preventing disease, maintaining wellness, promoting and restoring health, and advocating for death and dignity. I believe where I met this objective was in Nursing 4620, Care of Patients with Compromised Multiple Health States. First assignment was in discussion number 5, which was care of patients with trauma, compromised immunity, and end of life. This discussion focused on common cultural preferences for end of life, discussed the nurse as a patient advocate, as well as maintaining documented advance directives within the chart. I also replied to a post from a co-student regarding family presence during resuscitation, which is a highly contentious topic. However, it does show a decrease in psychological trauma to the patient, which is a positive outcome. I also met this objective with the practicum reflection 1 through 4, where I was able to compare and contrast a client in the community through an interview versus a patient that we read about in a memoir. I compared and contrasted their knowledge, risk factors, coping mechanisms, compliance to care, and spiritual aspects of healing with similar diagnoses. Student learning objective number 3 says evaluates patient-centered care for patients, clients across the lifespan based on common complex health needs and compromised multiple health states when considering multiple determinants of health. I believe I met this objective in Nursing 4540, Care of Communities. The assignment was the Community-Based Student Learning, Civic Pride, and Diversity Initiatives assignment. I focused on the health disparities of the LGBTQ community. I was able to visit a Pride Center. I interviewed some caregivers. I researched some community resources that offered gender-affirming surgery, STD testing, and HIV medications. I also believe I met this objective in Nursing 4316, Comprehensive Holistic Assessment. The assignment was discussion number 4, Esther Park. Esther Park was a 78-year-old widowed female who remained sexually active, and she had a lack of knowledge on STDs. We were able to educate Esther on prevention, such as use of condoms, made her aware that 25% of the HIV population is over 50, and that STDs have been on the rise between 2007 and 2011, mainly because of some sex drugs known as Viagra and elderly people living in close quarters. Student learning outcome number 4 is on the evidence-based practice and clinical reasoning construct. It says it synthesizes clinical judgment in nursing practice, utilizing critical thinking, nursing process, research, and evidence-based practice. I believe I met this outcome in Nursing 4316, Comprehensive Holistic Health Assessment. The assignment was activity number 2, nursing process, which we developed a care plan for Brian Forster. Brian Forster was a 58-year-old male. He came in with complaints of chest pain, 6 out of 10, squeezing to the chest. The patient was 3 days post-op, comorbidities of diabetes, increased cholesterol, and a family history of cardiac disease. Through the use of specific canons from Nightingale's environmental theory, it helped us guide the nursing process and develop a care plan for Brian Foster. Student learning objective number 5 comes from the patient-client centered care construct, and it says it employs safe, effective patient-centered care using theories and evidence-based findings in collaboration with patients, clients, and members of the interprofessional and intraprofessional healthcare team. I believe I met this objective in Nursing 4550, Nursing Practice, Leadership and Management in the Healthcare System. The assignment was the Module 2 discussion, Healthcare Quality. I spoke to bedside shift report as a evidence-based practice which shows a positive outcome in patients. I spoke about how my facility has the protocol in place, however it does not occur 100% of the time. And we spoke about family involvement and how it improves outcome as per the Agency for Healthcare Research and Quality. And you see the quote there, patient and family engagement creates an environment where patients, families, clinicians, and hospital staff all work together as partners to improve the quality and safety of hospital care. Student learning objectives number 6 and 7 both come from the professional roles construct. Objective number 6 says differentiates multiple role dimensions and practices within ethical, legal, and regulatory parameters when caring for patients/clients as a member of the interprofessional and intraprofessional healthcare team. I believe I met this objective in Nursing 4320, Nursing Theories and Online Education. The assignment was the Differentiated Essential Competencies, the DEX formal APA paper. DEX identifies basic educational and role preparation established by the Texas Board of Nursing in 2010. 4 roles through which the DEX guides competence are member of the profession, provider of patient-centered care, patient safety advocate, and member of the healthcare team. The paper described the different roles of the associate degree nurse versus the bachelor degree nurse in regards to an incident occurrence at a facility. Student learning objective number 7 says it demonstrates professional integrity, effective communication, active inquiry, and service to the community. I believe I met this objective in Nursing 4540, Care of Communities. The assignment was lecture assignment number 1, Introduction to Community Health Nursing. In this assignment, I was able to learn about historical nursing leaders in public health, disseminate different definitions such as population, community, and aggregate. We spoke about upstream thinking, macroscopic approach, and population-based nursing versus individual-based nursing. The other assignment I chose was practicum assignment number 3, the project teaching plan, where after I conducted a windshield survey of the local community, I was able to visit 2 local community centers for the disabled, and I developed a teaching plan for disaster preparedness based on evaluation of my assessment and their lack of knowledge. My current 5-year plan is to graduate from Lamar University with my BSN, pass the certification for infection prevention and control, the CIC exam, become a director of infection prevention and control, apply and graduate with my master's degree in either education or public health from Lamar University, of course, and to educate future nurses to help promote the profession. Thank you very much.